Out-of-home care is the care of a child or young person by a person other than their parent at a place other than their usual home. In Victoria, around 10,300 children and young people live in out-of-home care at any one time. Occupational violence and aggression, or OVA, has been identified as a key risk for out-of-home care workers. To identify opportunities to address this risk, a systems analysis of OVA was undertaken. We focused on client-on-worker OVA incidents in the residential care out-of-home care environment. We used Rasmussen's risk management framework to conduct our systems analysis. Jens Rasmussen was a human factors and system safety professor in Denmark. The development of his framework is now widely accepted within safety science as the most appropriate approach for understanding and preventing incidents in work systems at multiple levels. Using Rasmussen's framework, we derived 5 key principles. Safety is a shared responsibility. Incidents, injury and illness rarely have a single cause. Many factors may influence and impact on OVA incidents in the workplace. Consultation at all levels ensures that work practices are informed by what is really happening in the work environment. The safest way should be the easiest way. The risk controls in the system should not be dependent on people performing many checks and closely following procedures. We know that due to pressures on the system, risk controls erode over time. Therefore, good monitoring processes need to be in place. Our program had 3 aims: to identify the actors who share responsibility for OVA, to identify the multiple interacting factors contributing to OVA incidents, to identify potential interventions to prevent and reduce the risk of OVA. Step 1. The identification of stakeholders and engagement, consultation and collaboration, or actor map development. WorkSafe invited community service organisations, or CSOs, and Aboriginal community-controlled organisations, ACCOs, to participate in this program. WorkSafe also recruited inspectors, clients, and other key stakeholders. Using Rasmussen's framework, we identified all of the groups or actors who share responsibility for OVA in the sector. These actors were displayed across a hierarchy of different levels in an actor map seen here. This system has many actors at each level. In some cases, we have even divided a level into sub-levels. Step 2. Identification of contributing factors. Development of AXI-maps. To identify all of the factors contributing to OVA incidents at all the different levels, we conducted interviews and workshops with representatives from the participating organisations. We also held workshops with representatives from the Department of Families, Fairness and Housing, the Centre for Excellence in Child and Family Welfare, and the Australian Services Union. A client experience focus group was consulted, and data was collected from relevant WorkSafe entry reports and notices and inspector interviews. This information was then analysed and displayed in an AXI map. The AXI map shows the interacting factors contributing to OVA incidents at each level. From these factors, 5 themes were then identified. 1. The role of staff consistency and supervision in frontline care teams. 2. The role of staff competency. 3. The role of matching clients to staff, the residential house, and other clients. 4. The role of facility design and factors related to the environment and equipment system level. 5. The role of learning from incidents through reporting and investigation, and the culture around OVA in the sector. A separate AXI map was developed for each theme. Here is an example for theme number 5. Step 3. Identification of potential actions to address OVA, development of Preventi maps. Further workshops were conducted to address our final aim to identify potential interventions. These interventions were visually represented as a Preventi map for each theme. Here is the Preventi map outlining the potential interventions at each level for Theme 5. Taking a systems approach to addressing OVA has given the out-of-home care sector a broad understanding of the complexity of OVA incidents. The process was rigorous but practical and clearly showed the different stakeholder responsibilities and relationships. Using Rasmussen's framework brought those at all levels of the system together to collaborate. The potential interventions, shown as Preventi maps, gave them a point of reference to inform next steps and align future prevention activities. So far, the systems analysis has been used to inform multiple activities in the residential out-of-home care sector, including 1. The development of a safety leadership framework called LEADERS, Lead for Residential Care Sector, to prevent OVA in the out-of-home care sector. 2. The development of a baseline safety leadership survey. 5 leadership surveys were then customised and conducted, one for each level of leadership. This survey will be conducted again at the conclusion of a broader safety leadership program. 3. The development and trial implementation of an OVA training program. This program is unique in that it has been customised to each level of the sector, from CEO, leadership, through middle managers and supervisors, to workforce and health and safety representatives. Co-designed with the sector, it uses e-learning as well as applied learning techniques with initial post-training evaluation findings encouraging. Leadership feedback shows improved understanding and the need for leadership commitment in addressing OVA.